I'm David Rice. I'm the Nursing Director of Professional Practice and Education here at City of Hope. I've been here for 2 years. I've been an oncology nurse for 23 years. My clinical expertise is with hematopoietic cell transplantation and currently with practice and education.
My name is Mark Saris. I'm an intensive care nurse here at City of Hope. I primarily take care of ICU patients. And I've been with City of Hope for about 3 years now.
Mark and I both attended the ELNEC course that was held in Anaheim in January of last year, and it was a train-the-trainer course, and it had all of the tracks with it, so pediatric, geriatric, the core course, the ICU course. So we were able to actually send a fair number of nursing staff and leadership staff to the conference, so it was really excellent just to be able to see all levels of nursing there and to have staff nurses and leadership really appreciate the ELNEC program and the train-the-trainer nature of the ELNEC program.
For me, I was one of the nurses at the bedside that David invited. And ELNEC for me was a humbling and very enlightening experience, simply because it allowed you to not only learn with your colleagues, but so many other people that may have or have the same fears and insecurities regarding end-of-life care. And it really, I think, was enlightening for me because it forced you in a way to face those challenges, face those fears and insecurities you have caring for patients at that stage, and really enhance the tools and skills that you have in order to meet the needs of the patient, the family, and really care for them in terms of the whole spectrum.
So in September, on 2 separate days, around 8 nurses will participate in a sort of modified ELNEC training, a modified curriculum that's geared specifically toward pediatrics and incorporating the CARES model. Based on that pilot, then the quality of life team will sort of pick up the mantle and based on how it worked and any modifications, design it then for the other inpatient and outpatient units.
So one of the biggest things that I learned at ELNEC was this idea, which may seem simple, is the idea of presence. And I think the word of it is simple, but the actual concept is much larger than what it seems. The idea of presence really comes from approaching your family and patients when you come on shift in a way that will be therapeutic for them. And one of the biggest things that I learned in ELNEC was just that, approaching your patients, understanding when you get report that this is that stage for them, and really developing your approach so that you can be therapeutic in your communication, therapeutic in your approaches, being there for your patients and really engaging them in such a way that it will make a lasting impact for them.
Well, I mean, I would obviously say every nurse, right? I mean, everyone who has occasion to touch patients and families as they approach serious and life-threatening illnesses, as they approach end-of-life care, every nurse would benefit from the program. As Mark said, presence is a really important issue, and it really is absolutely meeting the patient right where they are and not going in with any presuppositions or preconceived notions, and then learning about your patient, learning about their families, learning their cultural aspects, their preferences, how they like to be treated, and being able to deliver culturally competent care to your patients. So I think all nurses could benefit from it. And then from the many components, there are aspects of end-of-life care, aspects of symptom management, aspects of pain management that although nurses are aware of on a certain level, they may not they may really benefit from a deeper dive in the curriculum, and that's what ELNEC offers you. So even as you introduce it into your own organization, you can really customize the module specifically to the needs of your nurses and their learning.
The most significant module for me from ELNEC was pain management, and a lot of the myths and insecurities that nurses have at the bedside really carries on in the care. So being able to face those insecurities, myths, and gain the understanding that yes, some of it is valid and there's rationales behind it. The best practice really comes from approaching it in a different way that kind of turns your practice upside down. And ELNEC was just that. It turned your practice in a way where you approach pain management in a whole new spectrum, a whole new different ideology. Especially during this stage, we always are concerned of over sedation, over medication at that stage, but then it becomes to where your idea of it changes for you, and you understand that okay, yes, that patient does require a higher dose of a pain medication, and it's important, especially at this stage, to understand that and be okay with that as a professional, and be okay to approach it in that sense, so that the patient will not only get the care that they need, but also be comfortable, because ultimately at that stage, comfort and really being there for the patient and the families is most important.
One of the modules that stands out to me really has to do with the last hours of life, and I think that's something that, as Mark said earlier, young nurses in their educational and practical preparation will experience terminal patients and they'll experience death and dying, but not not enough sort of quantity to really get to be comfortable with it. So the fact that the curriculum does delve into really what are those last hours about, how does the patient experience death, what symptoms will they express, how do you control them, what will the patient's family's perception of the dying process be, and how are you there for the family. So I do think one of the most compelling statements that comes out of that literature is the idea that even though it's not acute care like we think of it, taking care of a patient at the end of life is every bit as acute as ACLS is, right? So it requires just as much time and attention to the care of the dying than to the care of an acute patient.